My name is Sharon Schmidt, and I am a DMP candidate at Sacred Heart University in Fairfield, Connecticut. My dissertation project will study pediatric asthma management. Asthma is the one most common disease of childhood. 9.6 million children under the age of 18 have been diagnosed with asthma. Asthma prevalence is higher among children ages 17 years and younger than adults. Despite having excellent treatments, asthma remains the #1 cause of preventable hospitalizations for children in the United States. The National Asthma Education Prevention Program, NAEPP, Expert Panel 3 published guidelines for the diagnosis and management of asthma. Clinical practice guidelines provide information and guidance on the best and most current evidence available to diagnose and manage asthma. In order for guidelines to reach their full potential in achieving positive patient outcomes, it is necessary to have widespread acceptance and utilization. Quality asthma care must be readily and effectively delivered by healthcare practitioners. Advancing asthma guideline implementation improves the quality of care and outcomes of people with. Despite the development of evidence-based practice guidelines for the treatment of asthma in children, compliance with the guidelines is low, and asthma continues to be an important and growing problem for children and their families. Many strategies have been used unsuccessfully to improve clinician compliance. The guidelines have been viewed as a form of cost containment. Belief that corticosteroids are not safe for children continues. The guidelines are too long, too complex, and difficult to implement. And there is a lack of knowledge of the latest medical literature. Despite efforts to improve guideline compliance, clinicians rarely access and use the guidelines. The literature indicates that previous solutions to improve guideline compliance have been primarily focused on provider reminder tools. My dissertation project aims to improve and maintain pediatric asthma management with consistent use of the National Asthma Education and Prevention Program of the National Heart, Lung, and Blood Institute Expert Panel Report 3, Guidelines for Diagnosis and Management of Asthma. My research question: do pediatric asthmatic patients who receive care from an interdisciplinary clinical team compared to a traditional office visit have improved compliance to the NAEPP guidelines as demonstrated by clinical practice, documentation, diagnosis, and patient outcome? This study will use a quasi-experimental one-group pre-test post-test design by retrospective chart review to examine the adherence to the NAEPP guidelines before and after the implementation of an interdisciplinary team approach to a traditional office visit. The non-equivalent control group pre-test post-test design involves two groups of participants from whom the outcome data are collected before and after implementing an intervention. Inclusion criteria: children between 5 and 18 years of age, children with a diagnosis of asthma, children with a diagnosis of wheezing, a medication record of asthma medicines ordered daily or on an as-needed basis, acute care, emergency room, or hospital admission with a discharge diagnosis of asthma. Exclusion criteria: children less than 5 years old and older than 18 years of age, asthma with comorbid conditions, and other pulmonary diseases such as bronchitis, pneumonia, upper respiratory infection, gastroesophageal reflux, and vocal cord dysfunction. The setting is an ambulatory pediatric clinic in a large staff model HMO, whose visit volume is approximately 1,400 visits per month. The current care delivery model provides newborn, routine, well child, same-day sick, and follow-up visits. MDs and APRNs typically provide care during a 20-minute routine visit. Simple random sample of patients meeting the criteria will be used. The independent variable. Pediatric asthma patients who receive care from an interdisciplinary clinical team compared to a traditional office visit. Dependent variable. Compliance with the NAEPP guidelines for the diagnosis and management of asthma as demonstrated by clinical practice, documentation, diagnosis, and patient outcome. Confirmation of case status by manual review of the medical record will be incorporated into the study design utilizing a chart audit sheet. Randomly selected pediatric patient medical records will be selected and reviewed to document asthma guideline compliance in the pretest. An interdisciplinary healthcare team, including physicians, nurses, medical assistants, pharmacists, health educators, and allergists, will be charged to review the medical record data, identify gaps and opportunities for improvement, including education, templates, role definition, and steps or algorithms of an interdisciplinary clinic appointment with the goal of guideline compliance. After a 6-month implementation of the interdisciplinary team appointment, a second medical record review will be conducted to document asthma guideline compliance in the post-test. Manual review of the medical record data will be incorporated into the study design utilizing a chart review audit sheet, which will be piloted to establish practicability. The audit sheet will be subject to rigorous pre-testing so that it can be evaluated and refined. This researcher will test for stability by completing test-retest measures of the chart review audit form. Internal consistency is not applicable to this chart review audit. The second criterion, according to Pollitt and Beck, for evaluating an instrument is validity. Validity is the degree to which an instrument measures what it's supposed to measure. This researcher will test for face validity and content validity by contacting pediatric asthmatic experts to review and validate the chart audit review form. The primary researcher will be responsible for the data collection procedure, including collection protocols, collection forms, and data management. Institutional Review Board approval will be obtained from the Staff Model HMO and Sacred Heart University. Confidentiality of the study will be maintained according to institutional standards for privacy of identifiable health information and assigning an identification number to each record review. The data will be maintained on a computer with restricted access and housed in a secure server. Descriptive statistics will be used to examine and describe the sample. Descriptive statistics measure central tendency and variability. Bivariate statistics will be used to examine the relationship and strengths of the relationship between the interdisciplinary team appointment and the NEAPP guideline compliance with a separate analysis for each of the outcomes identified. This researcher will include correlational indexes for each of the variable relationships. The statistical package for social science software will be used to analyze the data collection. In conclusion, previous research related to improving compliance with pediatric asthma guidelines has produced modest improvements. This research dissertation aims to demonstrate that an interdisciplinary team approach to develop targeted and effective implementation strategies at each phase of the clinic visit will improve asthma guideline compliance and patient outcomes.